Okay. Okay, I have case number 3, which is demonstrating a lateral transfer with a sliding board. The client is a 40-year-old female who has a recent diagnosis of a right traumatic above the knee amputation and an abrasion on her left lower extremity, secondary to a motor vehicle accident. She continues to require an IV fluid and pain medication. Her diagnosis history is uneventful. She's independent with bed mobility skills, but takes extra time. She performs lateral transfers to and from the bed, wheelchair, and commode with the sliding board with min assist of 1. So before we get started, I would generally bring, if I'm gonna have her sit up, I would bring over the IV pole to this side before we sit up, but I don't have the IV pole. Okay, so the first thing I want to show you is that if your right leg, you have a wound, I'm gonna have you sit up in the bed so you can push up through your elbows to sit up. Go ahead, there you go. Very good. And if you want to scoot up, you can push with your good leg. Go ahead and, yep, and then, yep, and lift your head up. Go ahead. There you go. And if you need to sit forward up in the bed, you can push with this and lean forward. Push to push back. Yep, there you go. Very good, very good. Okay, now I'm gonna help you bring your legs over very slowly. Oh, well, that one's the one. Go ahead. Very good. And let that go. Okay. All right, now that we're sitting at the edge of the bed, I'm gonna go ahead and put a gait belt on you. Go ahead and scoot all the way to the edge of the bed so that your feet are on the floor. There you go. Thank you. So to perform a transfer to the wheelchair using a sliding board, and make sure that the patient has their balance a little bit. And I'm gonna angle the wheelchair at about 45 degrees. This wheelchair doesn't wanna walk. There we go. And then I'm gonna take the sliding board and I'm gonna have Famita go ahead and lean over a little bit. There you go. And I'm gonna make a bridge to the wheelchair. Then Famita, I'm gonna have you sort of lean towards me and we're gonna scoot onto the bridge to the wheelchair. Very good. Oh, very good. You did a good job. Then she can lean up and I'm gonna take the sliding board out. Then after that, now you could also bring the IV pole around at this point in time too. And sometimes I bring it before I even start moving. So now that we have her sitting in the wheelchair, we would put the armrest back on. Okay. And then that's it.